During pregnancy, one of the things you should start thinking about is how you're going to feed your baby after they're born. The American Academy of Pediatrics recommends that babies are exclusively breastfed for the first 6 months of life, and that recommendation is given based off the fact that there are so many benefits for breastfeeding, both for mothers and for babies. A lot of moms make the decision to breastfeed because they know it's best for their baby, but they don't realize there's many benefits for them too. There are many health benefits. It helps you to recover faster from delivery because the hormone of letdown that causes your milk to release so your baby can eat is oxytocin. And oxytocin is also the hormone that causes you to have contractions during labor. So when you breastfeed, it actually helps your uterus to cramp down to its pre-pregnant size and heal faster. It also helps to control postpartum bleeding, and it helps with postpartum depression. Other added health benefits include a reduced risk of developing ovarian and breast cancer later in life, as well as other serious medical conditions like type 2 diabetes, cardiovascular disease, high blood pressure, high cholesterol, and even rheumatoid arthritis. Breastfeeding is also just really convenient. You don't have to worry about bottles. It comes out at the perfect temperature, is ready for your baby at any time, and it will save you a lot of money. The going rate for formula right now is about 10 cents per ounce, and it might be a little bit more, a little bit less, depending on the type and brand that you're purchasing. But over the course of the baby's first year, it will save you over $1,000 if you choose to breastfeed. Of course, one of the biggest perks for moms is that breastfeeding actually helps to promote bonding between you and your baby. Hormones are released while you breastfeed that help you feel closer to your baby and that help your baby feel closer to you. It makes you feel really relaxed. It gives you a sense of joy and peace. And breastfeeding is the one thing that only a mother can do for their baby, and that adds to the fulfillment and happiness they receive from breastfeeding their children. And as for babies, the benefits are endless too. Breast milk has the perfect balance of nutrition that a baby needs during their first year of life. It's easy to digest, and it comes with disease-fighting properties that help to protect them against illness. It's a fact that breastfed babies actually have less illnesses and infections over the first year of life, specifically ear infections and lung infections. They also vomit less, have less diarrhea, have a lower chance of developing allergies, and it reduces the risk of sudden infant death syndrome, or SIDS, during the first year of their life. The benefits don't end there and actually extend into childhood and adulthood. Children who are breastfed are less likely to develop childhood leukemia, asthma, atopic dermatitis, type 1 and type 2 diabetes, and they're also less likely to be obese and to have high blood pressure as adults. So as you can see, breastfeeding is always best if possible. With that said, there are some mothers who can't breastfeed. There are many different circumstances that might necessitate the need for formula, and thank goodness formula is there too, because it can also meet the nutritional needs of a baby. And the most important thing is that they're happy, healthy, gaining the appropriate amount of weight, and thriving. So if that requires formula, that's okay too. Talk with your pediatrician if you have any questions about breastfeeding, and if you have more questions for me in the future, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.